Fellow Kenyans, yesterday afternoon, I gave an update on the status of the coronavirus disease, confirming 7 cases of the disease in Kenya. Of the 7, 6 are Kenyans, while the remaining one is a Burundian national. All the 7 are doing well under the observation of the Ministry of Health and Kenyatta National Hospital staff. It is important to note that all these cases have been imported from outside the country. Ladies and gentlemen, in the last 24 hours, we have screened and tested another 8 cases, all of which have turned out negative and are being processed as we speak to be discharged to go home. So this is good news that today we are not reporting any increase in the positive cases that we have in the country. We are, however, continuing with tests and contact tracing, and we have already contacted 145 people who have come into contact with persons who have tested positive for the virus. It is also worth noting, I think, that we have screened over 600,000 people who have entered our country in all our entry points. I wanted to make this clear because yesterday I had a discussion on one of the TV stations where somebody said that we have screened 32 people. I think it is very important to separate between screening and testing and then confirming. It's a very important distinction, because I think somewhere along the line we are missing out the point, and perhaps we should take responsibility because we are the ones communicating the same. We have tested, so we have screened over 600,000 people at the airport and elsewhere. Some of you were there when we were doing screening in the Ongata-Ongai area. We have tested 173 people, out of which 7 are the ones who have turned out positive. Fellow Kenyans, the good news is that the 7 patients are in stable conditions. And indeed, today, we began the test to see whether any of them might have turned positive. This is something that we will be discussing again, turned negative. This is something that we'll be discussing again tomorrow. However, we continue to appeal to Kenyans in order to break the chain of transmission of this virus. We continue to maintain high standards of hygiene as we have advised. To this effect, the government has directed the involvement of the Nyumba Kumi leaders, sub-chiefs, and chiefs in ensuring compliance to these directives, but also in creating the smallest units in terms of the management of the disease. The purpose of invoking the Nyumba Kumis and the sub-chiefs is that if there is a problem within that area, the sub-chiefs and the chiefs would know very quickly in which Nyumba Kumi there is a problem. Now, this we want the citizens to take very seriously. And I want to say, ladies and gentlemen, that as much as a lot of our people are not taking it lightly, there are those people, skeptics, who continue to pour doubt as to the seriousness of our situation. I urge you to continue as members of the Fourth Estate, I urge you to continue to educate and affirm that this situation is real. It cannot be unreal in Kenya when it is real in China, it is real in the United States, in Spain, in Italy, and we think that in Kenya it is something to joke around with. It is not. It is not. And sometimes one is baffled by some of the reaction that we are getting. Please, please, let's take this matter seriously. Secondly, we will embark on random screening in targeted areas for members of the public, commencing this Saturday, March 21st, 2020. The exercise, to be coordinated by the Ministry of Health, will also involve other stakeholders, such as the Red Cross and security personnel, among others. Thirdly, we are structuring the team that is dealing with combating this virus. The Public Service Commission has today approved the remaining Ebola champions who have now been incorporated to assist in the COVID-19 response interventions. Our public health team has also embarked on disinfection of various premises and locations in the Nairobi city. We are liaising with county governments to escalate the same in the rest of the country. At the same time, I'm appealing to Kenyans who have been advised to work from home by their respective institutions to do exactly that. This is not a holiday season. It is time to fight a deadly virus. By congregating in entertainment joints, bars and restaurants, we will beat the very purpose for which they were asked to work at home. And we will resort eventually to us taking action against the institutions that people are gathering in. As we said, we are seeking for citizen responsibility. And that's a pregnant term because it carries with it certain aspects of behavior that we must change, ladies and gentlemen. And therefore, if we have been asked to take our children home and to isolate our kids, it did not mean that we now start taking them to the shopping centers, we start taking them to markets, we start taking them to playgrounds and museums. That is not what the intention is. The intention is to create social distance. So even while we are at home, if we do not keep social distance, then we will be defeating the logic of why we are doing it in the first place. I am appealing to Kenyans, therefore, to observe the instructions that the government has given. Entertainment areas, entertainment joints have been advised to stick to very strictly, to stick to a number of things. Number one is levels of cleanliness, sanitation, and hand washing. That's one. Number two is to stick strictly to the hours that they are supposed to operate. Very strictly to the hours that they are supposed to operate. Any institution of entertainment that is operating a minute beyond the hours that they are supposed to operate will have their licenses withdrawn. Finally, I want to appeal to members of the public to desist, and I have said this almost in every meeting that we have had, almost in every press conference. We have appealed to people to desist from any form of misinformation I think you are all alive to that the social media has been abuzz with all sorts of rumors, including that we are locking down Nairobi, that we are sending people home, that we are doing this and we are doing the other. Things that have come from nowhere, that we are deploying the military. You know, these rumors must stop. They must stop. And I think that members of the press, I would appeal to you to make this very obvious and to highlight this matter. And the reason why it is so important for us to do so is because when you tell people in social media to stay away from a hospital or to stay away from an area because there are suspected cases there, and it is false, one day it will be the truth, and people will still think it is false. You all know the story. I don't know whether you do. You all know the story of the boy and the leopard. It's an African story. This is what is happening today. We have got people who are spreading malicious rumors, falsehood within the internet, and I'm appealing to them to stop. But because we are aware that empty appeals will not work, we will proceed to arrest a number of them just to prove our point. And of course, since they will have something to report regarding coronavirus, we'll oblige them by taking them to Mbagathi, where they can report the matter, because, you know, that's where the issues of coronavirus can be handled. So they can go and visit and give their reports there. I still want to appeal to Kenyans for them to remain calm and not to cause panic. In fact, it is persons in the social media who are causing concern and panic among citizens. And to say this, as long as we do what we are saying, if we are disciplined enough to follow what the government is saying, then we will contain this transmission. That is what has happened to the countries that have contained it. They have behaved very responsibly, and they have managed to avoid situations that could have been catastrophic. This is a challenge we have. We have no doubt that if we behave well, we will avoid the kind of scenarios that we are seeing in other countries. But if we do not adhere, and if we do not follow what the government is appealing to do, I can also tell you that the results will also show. Actions in this case, behavior in this case, has its consequences. As His Excellency, the President, assured you, on the day that he spoke to the nation, we have been faced with many a crisis before. And even this one, we will face in a similar format, with fortitude, with calmness, with unity, with cooperation. I want to thank all those who are taking their own initiatives to ensure that we are all involved in the fight against this disease and this virus. The business community, the non-governmental organizations, you members of the press. I want to state that we are very grateful to all those who are coming out to support our cause. I want to take this opportunity to appeal to members of the public to utilize the free number that we have said, and it is working. You can call the number 719, and when you are reporting a case, this is the number to call, and we are urging people to call them instead of calling individuals within the Ministry of Health. I want to stop there and take one or two questions, and this.
Kennedy, we're ready for next week. One question. What is the efficacy of these masks that people are using in town, and what would be the advice from the ministry, noting that from your statements since yesterday, you've been saying that you're having to learn so much from China, and we saw that in that one, people are wearing so many masks as they were going out alone. What is the efficacy? And number two, are we looking at a situation of setting up temporary hospitals with regard to your announcement of screening starting this Saturday?
Okay, I will explain the second one and then ask Dr. Amoth to respond to the issue of masks. But even as he responds, let me also say this. Long before coronavirus was here, the Chinese were wearing masks. It is almost as you wear a tie, they wear a mask. You know, so, but I'll let him respond to that particular one. On the matter of whether we intend to create mobile hospitals, we are not there yet. We haven't gotten there yet. We have got sufficient quarantine facilities. As I said, we are working with KMTCs, and they are all over the country, and they have got a huge capacity to quarantine people if there was necessity of doing so. But at the moment, we are quite happy with the exercise of self-quarantining. We have also infused a mobile-based system where once you come to the airport, and you must sign the declaration form indicating your number and your physical location. But once we have your number, we are able to keep tabs with your number 24/7. I think it is good to know that your number, we will keep knowing where you are at all times. You know, so it is important to note that. But we have not yet gotten to the point where we are thinking about other measures. As you yourself have said, if it came down to it, yes. But right now, it's not necessary. Yes, let me let Dr. Amoth answer to the question of masks first.
Thank you, Waziri. Masks are important, and let me make this very clear to the media and the public that the use of masks is only for two particular indications. One, if you are unwell, to prevent you from passing the droplet to whoever is taking care of you. Or two, if you are a healthcare worker who is taking care of somebody who is sick. Otherwise, use of masks gives you a false sense of security that then leads you, and because you are not used to wearing a mask every day because you are not a surgeon or a doctor, you end up in trying to adjust the mask, touching your face, your nose, or your eyes, which puts you at even a greater risk of transmission of COVID-19. And on top of that, if you are well otherwise, you are wasting a useful resource, which is very hard to come by now. Please, let's keep the mask for those of us who are unwell and the healthcare workers so that it can serve its intended purpose. Thank you.
Namaswa?
Our investigative team was following up on a people about a Kenyan who supposedly came from Lisbon, went to Serena and refused to self-quarantine, and police had been called to intervene.
Thanks, Mark, again. That information reached us yesterday through an informant who informed us of this gentleman who came from Lisbon on Sunday last week and has been all over. I think he was even chased from Windsor Hotel. Immediately, in conjunction with the security apparatus, we circulated his number, and eventually we caught up with the gentleman today at Serena Hotel, and we transferred him to the Mbagathi isolation unit for isolation and testing to confirm his status.
And I did say yesterday, Namaso, I did say that if, and I appeal to the members of the public to also help us with the policing, and you can see it is working, and we are thankful to those members of the public who said that and who called us. And of course, we will keep the gentleman, in isolation by force. If you cannot do so voluntarily, then we will keep you in isolation by force. And it is not necessary. It is very irresponsible for a person to know that they could have been exposed, and then they start going around dancing clubs. Honestly, and that's why we are telling members of the public, let us not accept. Having said that, I also want to say that you should not take the law into your own hands. If you are not a policeman, if you are not a health official, do not take the law in your own hands. I have warned before against profiling and xenophobia. And we have heard of a situation in Kwale, of a situation in Kwale, where people even beat up somebody just thinking that they might have a coronavirus, not knowing that those who are beating the gentleman up might be the ones themselves with the virus. Because unless and until you have been tested, nobody knows whether you have it or you don't. So it is very unfair. It is not right for anybody to be treated as such. So let's balance it. If you are supposed to quarantine yourself, quarantine yourself. If you leave your quarantine facilities, we will know, especially going forward. We will know. And once we know, we have no choice but to quarantine you. But we are hoping people are going to behave reasonably. Finally. Yeah.
Yes.
Okay, as far as the testing kits are concerned, we continue to buy as necessary. As you know, it has been in the media that the philanthropist Jack Ma has sent us through CDC some 20,000 testing kits. But even locally, we have continued to purchase locally. We have not run out of testing kits so far. What was the second question again? What was your second question, sorry? Testing is free. Testing is free. Nobody is being charged. No. What we are doing is that every day there are people, we pick people up, like for example the gentleman that you have had. So some of them are the ones that we had even yesterday, some of them. We have got new ones today. So every day is a changing situation. As they come in, the ones we think we need testing, we test. Final.
The World Health Organization yesterday said it is worried that the numbers in Africa will not be the position.
Your name?
My name is Stephen Leto from Citizen TV. The World Health Organization yesterday questioned the number of positive cases in Africa, saying they could not meet the true reflection of testing capacity. Should Kenyans worry about the numbers that Waziri you are giving them?
I don't think so. Not for Kenya. I can't speak for other countries. But I can tell you that for Kenya, we are confident about what we are talking about. Also, we must stop looking down upon ourselves. We cannot be we cannot be called banana republics 50 years ago and still continue to be called banana republics. They used to say we are going to be overwhelmed by the circumstances we are going to face. Maybe. God is our protector. Maybe, maybe not. But it is also good to acknowledge that even the so-called able people are also totally overwhelmed. All right? So let's not always believe in what somebody out there. They have got a very dismissive attitude about what we are able to do. So let's not look down upon ourselves. Let's behave If we behave, we will prove them wrong. Thank you.
Na mtazamaji